Hello, I'm Dr. Joel Schwartz. I'm a certified medical examiner with the Federal Motor Carrier Safety Administration, and today I'd like to help you get prepared to take your DOT CDL physical. I found that with drivers, I've been doing this exam for the past 4 years now. One of the things that is a big problem is preparation. If you prepare for your exam, if you know what's going to happen ahead of time, it often relaxes you, number one, and it'll help you get through the process quickly. Now, I'm going to go over everything you need to do in preparation for your exam. If you follow my directions and do everything I'm going to show you, it's very likely that you'll be able to come into my office and get your medical card within 45 minutes. So we're going to go over several things. We're going to go over what to bring to your exam. I'm going to show you the actual forms that we use when we do the exam, and you can download them from my website so you can know in advance what questions are going to be asked of you. We're going to talk about the medical conditions that the form asks you about. Okay, we're going to talk about what fitness for duty means. We'll talk about documentation. Documentation is something that your doctor might have to provide for me if you have a certain type of a medical condition. And if you plan for this in advance, know what documentation you need, you can already have it before you even come into your exam and get through the exam, as I said, very quickly. We'll talk a little bit about blood pressure, and then we'll finish it off by just talking about how to make an appointment and where you can park your truck or your bus. Okay, so let's start out with what you need to bring to your exam. Of course, some of these are obvious or self-explanatory, but I'm going to include them anyway. If you wear glasses or use contact lenses to drive, make sure you bring them to your exam. Same thing with hearing aids. If you use a hearing aid, bring it. Bring your driver's license, obviously. Now, if you have a waiver or an exemption, these pertain to specific instances. The Federal Motor Carrier Safety Administration makes it possible for certain individuals who have, for example, diabetes and use insulin to get a waiver and allow them to drive with the waiver. So if you're one of those people, you already know about it in advance. You'll get your waiver and you'll bring it in to me. Okay, if you have any questions about that, obviously you can call me. Bring in your list of medications that you use. Okay, and also drink a little extra water, because we are going to have you give a urine sample at the end of the test. The urine sample is not a drug test. We're looking for protein, sugar, and blood in the urine, and that's it. Okay. So we talked about what to bring to the exam. Fairly straightforward. Now, I would highly suggest to you that you look below here on my website. You can download the forms that I use for the exam. You can also get them from the Federal Motor Carrier Safety Administration website if you'd like. The name of the form is MCSA-5875, and I have it right here. Okay? So I suggest you get that form, take a look at it. On the second page of that form, it asks you several questions. It says, do you have or have you ever had, and it lists a bunch of medical problems. Not everything, but most of the problems that we're concerned about. Okay? So if you've had anything, so if you check yes, or you think you're going to check yes to any of these boxes, you're going to need probably to bring documentation about that. Some things you won't. If you smoke, it asks you if you smoke. You're not going to have to bring documentation about that. You can just write down how much you smoke on here, okay? But certain conditions, like if you have a heart attack, if you've had bypass surgery, those types of things, you're going to need to have some documentation. So if you have any question about whether you'll need the documentation or not, please give me a call. And I'll talk to you about it on the phone, and we'll get you prepared to start out with, okay? So the documentation is pretty important. I also put a form there that your doctor can use when he or she sends over the documentation to me. It's a form that allows them to give their release for whatever specific condition they're treating you for. Say, for example, you've had a heart attack in the past and you go to see a cardiologist. They're treating you and they're doing some studies on you as follow-up every year or so. That allows them to say that they're treating you for this and that you're good to go, and it gives them the ability to say, okay, I say that you're okay to drive a commercial motor vehicle. Okay, and they'll fax that form to me. Okay. If you don't have the forms in advance, it kind of slows things down. which is kind of a pain. So if you come in for your exam and you've had, say, bypass surgery and you didn't know that you're going to need release from your medical doctor for that, then I have to go and call him up or her up and get the information and have them fax it over to me. We'll still get the information, you'll still be okay, but it takes a little bit longer. I just want to mention too about these medical conditions that are listed on the form. Very few conditions are disqualifying. You're going to get your CDL in almost all cases. Okay, so don't let that worry you. I want to take the stress out of this exam as much as possible because it's not that bad a deal as long as you're prepared. The basic duty, my duty of any medical examiner is to assess your fitness for duty. So we're looking for to assess the risk that you might have a sudden incapacitation or a gradual incapacitation when you drive. So say, for example, you were diabetic and your blood sugar dropped way down, and all of a sudden you were not able to drive. That would be a very dangerous situation. So things like that, that's what we look for, okay? Again, it doesn't mean you can't get a medical card. You just need to go through the whole process. Okay, so we talked about medical conditions, the documentation. Blood pressure, I just want to talk about that briefly because when people come in for this exam, they often are a little bit nervous, even if they're not aware of it, and that brings your blood pressure up. Now, people who have smoked for a while and are overweight, your blood pressure automatically is going to be a little bit higher. So you may need to have seen somebody about that in advance. But if you're just a person who gets a little bit nervous, I would suggest that what you do is get a home blood pressure cuff and practice taking your own blood pressure and notice when, in what situations it gets high and when it seems like it's a little bit more normal for you. And then you can plan, you know, and sort of work with your own physiology on getting yourself into a state where you're relaxed enough to get your blood pressure low. You almost do a little sensory feedback on yourself. You take your blood pressure and you see how it comes out from day to day. Okay, so I recommend that highly. Now, as far as appointments go, with me, you pretty much can get in on any day that we're open, which is Monday through Saturday, to get an appointment. You do need an appointment, but I can get you in on the same day. So that should be good. We have a huge parking lot here, so if you're going to drive over in a bus or a tractor trailer, there's not a problem. There's plenty of room to park. Okay, so don't let that worry you. So at this point, I think I've covered everything I need to cover. If you have any questions, you can call me. My number is 732-698-7151. And I'll ask any question or answer any questions you have regarding the exam. Okay, thanks for watching, and I'll talk to you soon.